Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Welcome to the Dr. Raj podcast with today's guest host, Becca Spahr. Becca Spahr is a certified relational health coach who works with veterans and their families to help them find friendship, expand their professional networks, and build a sense of belonging so they can thrive after service. She grew up as a military kid and later served for 20 years as a U.S. Marine, learning that likability, authenticity, and attention can create belonging anywhere. Becca inspires her audiences through keynote speeches, workshops, and coaching, teaching them that connection is a skill that anyone can master. And now, here's today's episode.
Hi, and welcome to the Dr. Raj podcast. I'm Becca Spahr, excited to be back hosting another episode. Today, we are going to be giving some attention to a subject that we probably don't talk about enough, and that's because it's kind of uncomfortable to talk about. But the thing is, the more we prepare for it, the easier it is on everyone. And that is when someone gets sick. And I am talking about really sick people who have chronic illnesses, very serious illnesses that need to be managed. Our guest today is Christina Ring. Christina is a palliative care nurse practitioner in the Harrisburg, Pennsylvania area. And she helps patients and their families navigate these serious or chronic illnesses with the goal of managing their symptoms holistically for the best possible outcome. Christina, welcome.
Good morning. I'm so excited to be here. Thanks for the invitation.
Oh, I'm happy to have you. When we met a few weeks ago and we just talking for a few minutes, I was like, wow, she is so passionate about what she does. And what an incredible resource, just a font of information about this thing that we don't want to talk about. So can you walk me through a little bit about what it is you do and why it's so important to have these discussions ahead of these things happening?
Sure. So I work for a hospice and palliative care organization, but my primary focus is palliative care at the moment. I work with actually a home-based interdisciplinary team, and a lot of palliative care programs are kind of fundamentally the same, but they definitely can have some nuances. So, some hospitals have their own palliative programs, some are clinic-based, some are virtual, and I'm fortunate enough to work on a home-based team. So my job is to go meet patients wherever they are on their healthcare journey and really help to dive into what symptoms are starting to become distressing in their illness. And those symptoms could be physical symptoms like pain or shortness of breath, constipation, insomnia, things like that. It could be more emotional things, anxiety as they're struggling with the changes in their health or financial implications that are coming about because of their disease. It could be some psychosocial problems, spiritual distress, cultural struggles, things like that. So we really do look at the whole person and help them determine what is most important in their health.
Mm-hmm. Okay, so before we go forward, I want to make sure that I understand the difference between hospice care and palliative care.
Yes, this is huge because I can show up to the majority of my patients' homes and say, tell me what you know about palliative care. And I am met with a complete blank slate. They have no idea what I'm doing there. So I think this is really important because I think hospice and palliative are often used synonymously. And although they are similar in some ways, they're also very different in other ways. So palliative care really is just a supportive service. I tell patients, I'm another tool in your toolbox, and you can use me as much or as little as you need. Palliative care doesn't replace any of the other providers and specialists that people see. And under palliative care, it's really important to point out that patients don't have to stop doing anything. And that's one of the big differences between palliative and hospice. So under palliative care, you're welcome to go to the hospital, have surgery, continue with your treatments. chemotherapy, radiation. There is no limit to what patients can do under palliative care. And palliative care can really enter the picture at any stage in someone's disease process. I know people associate hospice with that 6-month mark, but there is no time limit to palliative care. It's usually, like I said, when a provider may make a palliative care referral, they may just be seeing that a patient is starting to struggle a little bit more with some symptoms, or may need a little more time to kind of sit down and think about what their goals are with regards to their disease. And with hospice, we talk about, that 6-month rule seems to really stick in people's minds. And that's just to say that we wouldn't be surprised if somebody passed away in the next 6 months. But people can stay on hospice longer than that.
Mhm.
But with hospice, our goal really is less about curative and more about comfort.
Mhm.
And so hospice also has a very interdisciplinary team to help support the patient and their family as they navigate really that last part of their journey. And I can tell you from doing this, hospice really doesn't make death come any faster. I think a lot of people think, oh, now we're throwing in the towels. You know what I mean? We're bringing in the hospice troops. But a lot of, there's actually been studies that have proven that patients sometimes live longer on hospice because we're streamlining medications and we're taking away sometimes, these aggressive treatments that have pretty unfavorable side effects.
Mhm.
And we're not running patients around to half a dozen specialists and doctor's appointments anymore. And when we really focus on just caring for the patient, a lot of times they do better.
And so I'm trying to think of how to phrase this, because this is just a journey, from diagnosis to
Mhm.
whatever the goal is at the end. And that might be that someone passes away, or it might be that they make a recovery. Um, you're the juggler who in this show who is collaborating with the patient and the family to see what their needs are, but then identifying who can help them with those needs. So you must have just an enormous resource list of everything that you just mentioned, from the physical symptoms to the emotional, the financial fallout. How do you keep track of all of that and navigate all of that?
It's a lot. This is definitely, I've done lots of different things as a nurse practitioner, and this is the one where I definitely wear the most hats.
Mm-hmm.
That's where the interdisciplinary team really comes in, because we have chaplains and social work and nursing support and, of course, providers that are the boots on the ground in the field. And plus, palliative really works with the existing team that the patient has in place. So we collaborate very well with their oncologist or their cardiologist or their nephrologist. And once palliative can kind of get in there and dig in a little more to help figure out what the patient's goals really are, then we work with the other players on the team too to help kind of make sure everybody's on the same page, and we can curtail the treatment plan according to the patient's wishes.
Mm-hmm.
But it takes a village. This is definitely a specialty where I can say without a doubt, it takes a village.
Yeah, it takes a village, and it takes an enormous amount of empathy, because I would imagine that your patients, they're going through a tough time, is an understatement. And first of all, a lot of people just aren't very read into, medical care and their own health, and may not understand exactly what is happening and why the tests are being done or what the test results mean. And because of that, they don't know the questions to ask. So,
Yes.
so there must be a huge element of like advocacy in this, where you, the nurse practitioner, have to be able to read the situation and ask the questions that maybe they're not asking for themselves. Is that something that you find to be true?
Oh, absolutely. I feel like a lot of patients really get stuck in this hamster wheel when they're ill and dealing with a chronic illness or life-limiting illness, and they have wholehearted trust in their providers, and I hope that they do. But a lot of times, they get stuck in like, well, let's try this medicine, and yes, you're having disease progression, but let's try this treatment now instead, and they feel obligated to keep pushing and trying more and trying more. And those treatments, although might be with the hope of providing more quantity to their life, a lot of times it's also then taking away from the quality of their life.
Right.
So palliative care gets in there and really helps to clarify what's important, where are the symptoms coming from, and kind of help weigh out the pros and cons of, is this truly worth it?
Right.
And it's exhausting. It's an exhausting role to play because doing this over and over again, like I pour my heart and soul into these people who are strangers to me.
Right.
Do you know what I mean? And so it takes a lot to do this but it is so unbelievably valuable and gratifying to help people along this journey. So it's worth it.
Yeah, you're a complete stranger to them, and yet you probably through the process get to know them better than a lot of their family members know them when you're talking about these intimate details of their lives.
Mm-hmm.
So how do the families play a role in this when you're dealing with like a long-term illness or a chronic serious illness? What do you see in terms of how the families play a supportive role and maybe what they could be doing differently to be more supportive?
There can be a disconnect between what their wishes are and what their family's wishes are for that individual.
Mm-hmm.
That is definitely something that we see quite often. And I think sometimes that's why I think it's important to be in a setting where palliative care, we have time to spend with patients. My average visit is probably 1 to 2 hours long. Wow. The average provider in an office setting just can't do that. Mm-hmm. But when I'm able to have a spouse or some children there, or do you know what I mean? We can all be on the same page and have the same discussion together. And I think that that's really helpful. But a lot of times patients, I think, feel guilty if they are getting tired of fighting their illness and fighting their disease. And I think that they continue with things sometimes longer because of their families. And they don't want to leave their families. And they know their family members don't want them to leave. But I think we have to remember, like, death is inevitable. That doesn't mean we're failing at anything. I mean, nobody on earth lives forever. And at some point, these bodies just fail. Some fail quickly and some fail slowly. And I think that helping people understand that kind of death is just a part of life. And the more we can talk about it and uncover all the anxieties about it and walk through it together, I think it really helps to decrease the fear then for patients as they do walk toward the end of their journey, to the end of their life.
It's interesting that you said that the patients often feel guilty about this process, and because they are maybe more of a burden on their family, or they feel like they're causing this like disruption in everybody's lives. We're having to put things on hold. We're having to, travel to be with them, whatever, that kind of thing. And so guilt is very much of it, a piece of it for the patient. But then I know that families also feel that guilt in different ways, because the last few people, like friends that I've known who have lost someone close to them, they have all said to me the same thing, which is that in a way they are relieved that it's over. Mm-hmm. Can you comment on that? Because you're a lot closer to this process than I ever am.
Yeah, I think, healthcare has changed so much, but I think even just the way people experience death is very different. And I recently heard that, 100 years ago, there were no nursing homes. We weren't putting loved ones in facilities and things like that. It's like when grandma got sick, grandma came to live with you, right? And the whole family took care of grandma. And grandma eventually passed away, probably in the home. Mm-hmm. And, the viewing was in the parlor, of these homes. And I think people just experienced death so differently back then. It was just a little bit more common and a little more personal, because they were seeing this a little differently. But now with families struggle too with, putting their loved one in a facility and things like that. But if you have working children within a sick parent, it's really hard to juggle all this. And then for the children, I say children and a parent, but it could be any situation of the family, but bringing that parent to their house amongst their dynamic. It's really stressful for people to be a caregiver. And I tell people all the time, it is way harder to be the caregiver than the patient.
Yeah.
100%. So people do sometimes feel relieved when we can stop running the rat race of treatments and interventions and just sometimes let people focus more on comfort. And then, you know what I mean? Just live the rest of their life however they choose.
Is there a way to kind of preempt some of those hard feelings by talking about this ahead of time or like at diagnosis? What would you recommend to people to try to, like, it's not an easy process, but to like make it, easier or as undifficult as possible? What would you say?
I think just helping people understand better what to expect. Because some diseases decline, as we said, more slowly, like maybe a dementia might be a really slow over years and years. I think that looks very different than maybe a cancer decline or something like that. And I think the best thing we can do is just educate the patients and their caregivers and their families on what to expect so they can kind of build a plan in place around that and to see how much they can be involved and what does this really look like as their loved one starts to really decline toward the end of their life. But the education, and it just takes time. It takes time and it takes so many touch points along the journey. I think the expectation that maybe diagnosis is very different as at 6 months and a year, and as we go down the line. So I think the constant check-in with palliative care is that, like I said, we are walking through this whole journey and we're looking at this with kind of a different set of glasses on. So we are able to kind of sometimes anticipate some pitfalls and some, when the things really start to change for people. And we're good at kind of helping say, okay, now this is now the new normal. Like, where are we going to go from here? And that's kind of what health, this decline is like, just new normals. That's what we're kind of helping people experience.
Yeah. There's just changes happening.
Yep.
Is what it looks like now. Yeah. Which is so hard for a lot of people to be comfortable with, especially I think when it's like a child looking to their parent who is declining, especially with things like dementia, where you have been the child and this person has always been the parent, the one who took care of you, the one who had their wits about them and who you could go to. And then the roles shift. And now the child often is the one in the caretaker role, which is really hard to wrap your head around and to experience for sure.
This episode is brought to you by Indeed. Stop waiting around for the perfect candidate. Instead, use Indeed sponsored jobs to find the right people with the right skills fast. It's a simple way to make sure your listing is the first candidates see. According to Indeed data, sponsored jobs have 4 times more applicants than non-sponsored jobs. So go build your dream team today with Indeed. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
So what about when we started off, you mentioned the differences between hospice and palliative care and that some people don't really understand the difference and that there are different goals. What are some other like myths or misunderstandings that people have about the work that you do?
I think when it comes to hospice, one of the things I think we need to clear up is that hospice isn't just for those last days of life. I think that the sooner hospice can get involved, the better the patients do. I think that, and I think hospice has kind of gotten a bad rap over the years because if families see that hospice comes in when someone has days left, it appears as if hospice enters the picture, maybe stops the medications, administers some other medications for comfort, and then within a few days, the patient passes. So from their perspective, it looks like hospice is hastening their loved one's death, when in actuality, hospice is coming in to put out the fires and to help provide medications to manage the absolutely normal symptoms that often accompany someone as they are dying. So I think we do ourselves a disservice by not allowing hospice to come in sooner and build a relationship with people and their families as they're navigating those last few weeks or months. I think another myth is that hospice isn't just for cancer patients. We take care of patients with a plethora of diseases, from heart diseases, lung diseases, kidney diseases, neurological diseases, strokes, dementia. I mean, it is literally as much as you can imagine. And I think a lot of people they have thought over the years, I don't need hospice, I don't have cancer. But it is definitely for anyone who is nearing kind of the end of their life. Hospice is not for people who are giving up. I think a lot of people sometimes feel guilty when they accept hospice, but hospice really is just for people who are looking to maximize the quality of their life. And I think if we shift that mindset, it doesn't have such a negative feel when we talk about hospice. Hospice can be provided anywhere. Some people feel like it's only a hospital-based service, but the majority of our patients are cared for at home. And home can be very many places, let me tell you. It could also be in a facility and things like that. So hospice teams can go see patients wherever they are. Most insurances are covering hospice care, so hospice is not expensive. I know some people are worried about the cost. And the other thing I wanted to point out is people think as soon as their loved one passes, hospice is over. But a lot of hospice teams have bereavement services that help the family walk that journey for like the year or so after their loved one passes away. So I think that that's one thing that people don't understand too, is the hospice journey and relationship doesn't end when their loved one passes away.
Yeah, I didn't know that. I mean, I can't say that I ever really thought about it that much, but it never really occurred to me that there would be continuing care for the grieving family after the death of their loved one.
Yeah. And you can actually get discharged from hospice. Some people think that's a done deal. The door closes behind you, end of story, but it's not actually true. Sometimes people actually do improve and they can get discharged from hospice. And sometimes patients, they just change their mind. Their goals change, and that's okay too. So you are able to be discharged from hospice. So that's one thing I wanted to make sure that is definitely a myth out there, that once you're on hospice, you're stuck with hospice.
I'll be the first to admit. I mean, I came into this conversation thinking that, hospice is like the beginning of the end. Basically, we're going into hospice. We'll try to keep mom comfortable, and in a few weeks or months, this will be over. But that's really interesting that that's not the end of the story, whether the patient themselves actually gets discharged or the patient passes, but there's still more for the family to services the family can utilize as they, continue the very difficult process of losing someone they love. So what about thinking ahead to when a family member gets sick? I can't imagine there's very many people who think like even ahead of the diagnosis. Like, if this happens to me at some point in my life, what's it going to look like? Are there people that do that plan for that?
Very few. Most people are more reactive.
Yeah.
But I tell them all the time, I mean, talking about death does not make it happen any faster.
Right.
And so I emphasize all the time with my patients, you having difficult conversations now while you're able to, and making plans when you're able to participate in the decision making is not only, it's challenging, and I understand how hard it is, but it is so much easier to have that ahead of time than when families are trying to juggle the last few days of their loved one's life and trying to make funeral arrangements and trying to do all these other things. And so I tell people that one of the best gifts you can give your family is to have these conversations early. It could even be before the diagnosis ever comes. But make some plans, have the conversations, get your wishes written down, get your documentation in place. And I can promise you that is one of the best gifts that you can give your family, so that they can just be present with you as you are walking through the last days, and they can just, be there instead of being pulled in a lot of other directions.
Right. Like adding the stress on top of the stress of all these things. That's to happen. Right. Well, you have been with so many patients and their families walking through these final chapters of life. And I want to know for you on a personal level, how has that affected you and the way that you think about living your life?
It really has. I've been in healthcare for over 20 years, but this is the first time that I have had a daily dose truly of gratitude. I feel like my patients are getting younger. I'm also getting older. But I really do feel like, not to be morbid, but on a truly daily basis, I think about my own death and how that would affect my family. And that makes me just live differently. I find myself being grateful when we take a picture over the holidays and the same people are in it in my family from the year before. And I kind of approach things very differently. But my personality is I tend to take on the weight of the world. I tend to get really bogged down by a lot of the daily tasks and responsibilities in life. But I'm trying to be more mindful, to be more present, and to carve out time to just enjoy my family and enjoy some downtime and look forward to another vacation and things like that. But definitely this is the biggest pill yet, is the daily dose of gratitude from doing this work so much.
I love that you find so much positivity and optimism in work that could really be very heavy. But there is a side to it that makes you feel like grateful for what you have, and do your best to extend it and enjoy it as much as you can while you have that opportunity.
Yeah, I tell patients I can't affect the outcome per se, but we can help affect the journey. You know what I mean? And that's really, to me, what palliative care is all about.
Yeah. As you know, as we talked, I do, my work is in social wellness and how connected we feel to the people around us and how easily we can access the resources that we have through our communities and the people that surround us. So I'm interested in your perspective on how, when a patient is going through this, how their connectedness affects them and their diagnosis, and how they are able to deal with through a tough time by having their family and friends around them. What do you see about that?
I can say with complete confidence that people who have a more robust support system and even a spiritual support system fare much better through the challenges that come through this. I've actually been quite surprised doing home-based medicine now, how many people live alone and don't have the resources that they need. And I think having previously worked in an office, I feel like patients come in on their best behavior when they see you in the office, but when you are in their home, you see what that really is like. You see who has enough food. You see, is it clean? Is their neighborhood safe? Are there pitfalls of things that are potentially going to cause an injury or harm? And I think that I've been really surprised with how many people, like I said, are walking this journey by themselves. So we kind of become their family when we need to be. But those that have tapped into some sort of spiritual connection and have a great support of family or friends or neighbors or whoever that is, they do much, much better. And I think their anxiety, even through their disease, is a lot better.
This was not a paid promotion for the importance of social wellness, I would like to add, but you're hitting all the marks that I tell people all the time. And so, I would say, as we've talked through this conversation about thinking about this ahead of time and putting, getting like the legal stuff sorted out and thinking about what your goals are and who you're going to lean on and how this process is going to go, having a solid support system really will make it that much easier. And so the time to be finding those people who will be supportive to you, to be nurturing those relationships so that we're all on good terms when this happens.
Yes.
The time to do that is now, ahead of a diagnosis or ahead of some catastrophic event that causes you to need palliative care or eventually hospice. So
absolutely.
Thank you for making me feel like I'm onto something here.
You're doing it right.
Yeah. Well, you have so many really great insights that I feel like everyone needs to know about. How do you get the word out about this? Christina, how do you get the word out about this?
I will talk to anyone, anywhere, as you know, about this. I feel like because this is I truly feel like toward the end of someone's life is such a special time. And I feel like I cannot tell enough people about what resources are out there to help them make this journey as smooth and as comfortable and as peaceful as possible. So I will talk to anyone, anywhere about this. I just feel like this information is not as clearly understood as it needs to be. So I am happy to talk to anybody who wants to talk more about this. Because this is hard. Listen, I've never died before. You've never died before. We've never done this before, but we can kind of help anticipate some of the things that are coming, and we can just make the journey a lot more comfortable.
Yeah, this is really valuable information and insights from somebody who's been doing it for a really long time. So I appreciate that. And I really think that a lot of our listeners will get a lot out of this. And I hope, listeners, that if you did get something out of this, or you know someone who is going through this or starting to go through this, that you'll share this episode with them so that they can learn more and arm themselves with knowledge ahead of an experience that will certainly try them in a lot of different ways.
Mm-hmm.
Thank you so much, Christina, for taking a little bit of time out of your day to be with us today. I do think that your work certainly is so important at what you said is a very special time at the end of someone's life, so that they can make the most of what they have and be surrounded by the people who love them. Any final thoughts?
No, I feel like we focus a lot as a culture on the beginning of life and the birth. And I think that the end is just as special.
Mm-hmm.
And I think that the way someone dies stays with their loved ones forever. And my job is to really, our goal is to make that as positive of an experience as possible. I want that memory to be something that they look back on and feel grateful for. So
That's
thank you.
an admirable goal. Thank you so much for the work that you do.
Thanks.
Thank you for listening to another episode of the Dr. Raj podcast. If you enjoy the show, then please make sure to follow us on your favorite podcast app and leave a rating while you're there. This show is for educational and entertainment purposes only and is not intended as medical advice. This has been a production of MedPrep2Go, and you can learn more at medprep2go.com.